Good afternoon. Today's topic is about tooth whitening. Tooth whitening really simply means we are trying to change the shade of the tooth, or if there is a color that the patient is not pleased with, to see if we can change that color. Now, there are different ways. It's part of the aesthetic dentistry that they change the tooth color. It was veneers, crowns, but those are a little bit aggressive because naturally there should be some alteration of the tooth structure, which does not happen with tooth whitening. In the concept of tooth whitening is really to see scientifically what is causing the discoloration of the tooth. One of the major causes is there would be some polymers that it will form, that this heavy chain polymers will give this kind of dark color to the tooth. So with the tooth whitening materials, the oxidations happen, and then this heavy chain that we talked about will break down. With that breakdown, the shade will change and there would be a whiter appearance of the tooth. So this is really the whole mechanism. Now, the causes of tooth discoloration, there are many causes, including the food, aging, medications. There are lists that we can go on. We call the discoloration, it can be intrinsic or extrinsic. Extrinsic means it's from the outer surface, which coffee, tea, carbonated drinks, and those, they can cause that. Intrinsic is from inside. Sometimes medications during the pregnancy can cause this discoloration. With tetracycline, the child may have this teeth discoloration. And that's why it's important, since there are so many different factors that causing discoloration, it's important the doctor will sit with the patient, do the examination, and then decide about the course of the treatment, that what would be the best method to help the patient. The tooth discoloration treatment in our office, we are using Zoom, which is very widely used in the United States and actually probably the most used around the world. So the procedure for that is, after, of course, evaluation and treatment explanation to the patient, it would be the gum, or what we call it, the gingiva, should be protected, and we put a rubber dam there, so only the tooth that they need to be whitened would be exposed to the light and to the materials that it is applied on the tooth surface. So when we put that gel on the tooth surface, then later with the light it would be activated. It breaks in 4 increments of 15 minutes each time, which is 1 hour, or sometimes based on the shades that we are changing, it may take more or less. So it's important to be evaluated and then decided. Now, at home would be like the patient will get the kit and they will apply it at home themselves. Naturally, in office would be much more controlled by the dentist, and the result would be faster. But for any of the questions, if you have about the tooth whitening, please do not hesitate our clinic. If any question, we will be happy to answer and to help. Again, thank you very much for your attention, and we will be looking forward to seeing you. Have a good day.